Hi, I'm Ruth Werner, and this is my audiovisual sidebar for my article in the January-February edition of Massage and Bodywork magazine, The Lowdown on Lightheadedness, Dysautonomia, and POTS, which stands for Postural Orthostatic Tachycardia Syndrome. POTS is something I'd heard about, but really only in passing until fairly recently, and it started to appear in a lot of the work that I do for my articles and other projects. So clearly, it was time for me to explore it further. One of the things I was most surprised to find is how common it is. POTS affects up to 3 million people in the United States. That's almost 1%, but most of us are completely new to this condition. I was really honored that my friend Kelly Thompson was willing to share about her experience with this condition as she helped her teenage daughter through a long, challenging process of diagnosing and then finding treatment strategies for POTS, including massage therapy. Even better, Kelly was willing to do this on a recorded call. So this issue's video is my interview with Kelly Thompson. So, Kelly, would you please introduce yourself and let us know a little bit about you?
Yes, my name is Kelly Thompson, and I have been a massage therapist for 12 years now, and I own a large practice in Eagan, Minnesota, called Eagan Massage Center. And I have a daughter who has POTS.
Tell us a little bit about her background and what led you to finding out that your daughter has POTS.
Yeah, it's been a really long journey, which I find is pretty common with people with POTS because it's not widely known yet. And they're not sure how people get it. And so we're not 100% sure how she got it. But when I look back in her history, when she was young, she did have a lot of viruses. She got sick a lot. She had bronchitis, pneumonia, strep throat a few times, stomach bugs. Seemed like she was always sick. And she would always complain of stomach aches for as long as I can remember. And so it started this journey years ago where we started with a specialist in a GI doctor, and she ended up being scoped up and down, and we couldn't find anything. And so years went by, and when she hit puberty and got her period around 12, things got really bad, and was always complaining of different symptoms because it's a syndrome, so it affects everything the autonomic nervous system affects, and that's a lot. So she would come in and tell me that her heart was racing and that she had chest pain and
scary,
she was gonna faint, and that she felt her vessels were too small in her body. And the descriptions she would use for things were just odd, and we started going to doctors and then started seeing a lot of specialists. So we saw a cardiologist and nothing showed up there. We saw a neurologist because she would get headaches and brain fog and trouble concentrating and lots of fatigue. And then the GI, she's been scoped and swallowed cameras and just has had so many tests. And she's 18 right now. This started when she was about 12. So we lived at doctor's offices. And what's trouble with this is you can't see it from the outside. So people don't have a hard time believing it, and doctors don't know a lot about it. So they'd look at her and say, "You're a teenage girl, you have anxiety."
Right.
It's all anxiety. And she would say, "No, this is not anxiety. I don't feel good." And very nauseous all the time. Mornings were really bad. So she started missing a lot of school. Hard to get up. And for these people, when they lay down for a really long time, that's not good. They have blood flow issues already. So in the morning, it's very tough for them to get up. And then hot showers, we realized at a very young age, she would almost pass out in the shower. She'd have to sit down in the tub because she was ready to pass out, and she'd just be so sick. So we noticed these weird things. And one day I was at an exercise class, and I met someone, and I was telling them about my daughter, and they said, "Have you heard of POTS?" I said, "No, I have no idea what that is." So I went home and looked it up, and I found it seemed like she had a lot of these symptoms. because all the test results were coming back normal. So we live close to Mayo in Rochester, and it takes a long time to get in there, but I fought really hard. And I got her in 2016, and we went down there, and they're kind of the experts at this, and they did a lot of testing and blood work and EKGs and a table tilt test, and said that she has POTS. And they gave us this book that explained it, and we were just so happy because it was like everything in there, it was her. We were reading about her.
That's so validating.
So a relief when you find that there is something. The big bummer is we found out there's no cure.
Right.
So you have to manage your symptoms. And teenagers, that's tough. So we went through a whole program at Mayo, and they educated us, and she did go on a beta blocker. She has had iron infusions. They tend to have very low iron stores and low vitamin D. So she'll get periodic iron infusions. And the beta blocker, her resting heartbeat, just sitting here in a chair, would be 120 beats a minute without doing anything.
Yeah.
And the big thing they want these people to do is do cardio exercise. And that is, when your heart rate's 120 beats a minute sitting there, that's really hard to do. So she learned how to manage her symptoms. It's very real, even though you can't see it. And that's what she would tell every doctor. This is not anxiety. I feel sick. Now, does it create anxiety and depression? Yes. It's just that's not the cause of it.
Right. And treating it with an anxiolytic is not going to solve it.
No, and we did a lot of counselors, so we went down that route too. Counselors.
That's good. That's good to keep grounded. Yeah.
Everything combined helped. But like I said, there's no cure. It just hasn't gone away. They did say that if you get it as a teenager, you can typically grow out of it. Hopefully.
I was going to ask if you had seen anything change over time.
So her nausea is the biggest part of it. And I think for everybody, it can be different. Some people will have more the lightheadedness and fainting. Some people, it can vary what's worse, but nausea is the worst for her. And then there's headaches dispersed in there. And she still does have that. When she's getting good sleep and she's kind of managing that gets a lot better. I think she functions better because of the therapy she's had. She realizes that it's not good when she lays in bed for days on days. It's always going to get worse, even though that's what they want to do. Right. So it's forcing herself every day to get up and go to class, go see friends, and fight that I want to just lay down. And so she needs to kind of fight that every day. And there's better days than others.
While she was with you, Kelly, did you ever give her a massage at all?
Oh, yes.
Yeah. And so what was different in terms of massaging a person with POTS compared to someone who doesn't have it?
Yeah. Well, she loves massages. It helps with her headaches. It helped just calm her. And it's that healthy touch. They're at doctor's offices and getting poked and prodded and tested, and here they're in an environment where you can create space and just give them a healthy touch.
There's such a difference, isn't there, between being touched and being handled?
Yes.
Yeah.
Very big difference. With her, like I said, mornings were just horrible for her. So I usually would give her massages more later in the day, maybe towards the evenings. I would not have her down for more than an hour. I don't think these people should be having 90 minutes or 2-hour massages. It's too much being down. She always has her Gatorade by her bed and, like a saltine or a salt cracker. They have to have a lot of fluid and a lot of salt. The salt keeps the fluid in their body and helps that blood circulation and blood pressure when they stand up. And then also what's helpful is being able to contract your calf muscles before you get up, maybe contracting your arms and getting that blood pumping before you stand up. Yes.
Yeah. So, I mean, those are things, having an electrolyte drink and saltines and encouraging people to contract those muscles before they get up. Those are some things that are outside the box of a typical massage therapy session.
Yeah.
But if we have clients who have POTS, then we might want to ask them, what's, how is it for you to get up in the morning? What
Right.
things make that easier? And then we can add some of those elements to our sessions.
Right. And make sure your environment is safe if they were to get up and pass out. Maybe not having something right on the floor next to the table or something.
Oh, like a slippery floor rug or something.
Right. Mm-hmm.
Interesting. Yeah, good point. What if you were speaking to other massage therapists who have clients who have POTS, what would you think it's important for them to know? Besides, these things that we've talked about safety issues, getting up.
It's really talking to the client and listening to their story and finding out how it affects them.
Yes.
Like I said, some people, it may be more the fainting, some it's more migraines. My daughter, it's more nausea. So, what is it that really affects them with this syndrome? And knowing that it's real, and just creating that space for them and listening, hearing them, and just helping them relax and giving them that healthy touch.
Lovely. And that's a theme I hear a lot when I ask that question of people about almost any condition is treat the person, not the condition.
Right.
And we do that by listening and not assuming that, oh, you have POTS, that means you faint, or, right.
Yeah. Don't assume. Mm-hmm.
Yeah. Okay. Well, I want to thank you so much for your time and really, really appreciate your participation in this. If people wanted to reach out to you to ask questions about POTS, is that something that would be okay with you?
Oh, for sure. Yes.
All right. Well, then I will put
got the word out, and thank you for inviting me.
Oh, I'm happy to do it. And I'll put some contact information for you in the article.
Thank you.
All right. Thank you, Kelly.
Thank you, Ruth.